I've worked with the LGBT community for around 10 years, and the continuing problem of them accessing any kind of service is around stigma and discrimination. So people feeling anxious and worried about the reception that they're going to get when they attend a service. Sometimes out of people not being aware of what their needs might be, sometimes around ignorance, sometimes out of prejudice.
I work with teenagers in the ISVA role within the LGBT community, and that's kind of an overlap a little bit with the children's and young people's ISVAs. So because they're obviously, because of their age, there's more safeguarding issues to be aware of. So we work kind of together often on those. I want to be able to give them the support that I feel they need. But at the same time, it's quite interesting to see how there's differences in how they get treated when they're trying to make choices about their gender and sexuality compared to, say, a straight person of the same age who would be able to go and access, say, sexual health service or contraception advice, whereas actually these young people, there's always that, oh, perhaps I shouldn't be telling them about where to look to meet, to get advice around if they feel they might be trans, or what do they do if they think they might be gay. It is very different. They seem to think, oh, if the parents find out, they might come back on me more. So it is quite interesting, the differences there. I think there's still a fear. But actually, in my eyes, I think actually I'd rather get them the help and support so they're doing things as safely as possible than not, and leave them where they're not having anything and they're struggling and the mental health and the self-harm is getting worse. So yeah, there still is a lot of issues out there for the LGBT community, young and old.
I think there's still a long way to go, but I think that there is, awareness is slowly starting to change. So people having an awareness that there's a community that maybe has some different needs, potentially, and also some awareness in trying to treat people the same as well. So it's like, yes, there may be additional needs there, but actually a lot of the time people just want to be treated the same. They don't want their sexual orientation or their gender identity to be their defining feature about themselves. It's a part of who they are rather than the defining feature of them. So for some people it's more about the comfort of having somebody that can maybe relate to them, and I think that anybody in a frontline service could potentially offer that. They don't have to be from that community, but it's just about having that kind of cultural awareness of the group of people. So using right terminology, using right phrasing, I think that's something that is really not, people aren't familiar with yet. I still have lots of conversations with organisations that don't know what the term LGBT is, and having worked in that field for 10 years, it feels like it's a really common phrase. And when people say, I don't know what that is, to be a business owner or to be a service provider or be a manager in a service and not be aware of that feels a little bit frustrating, I guess, because it feels like it should be fairly commonplace within society and our kind of language that we use now.
Within the LGBT community, there are some extra barriers coming forward, and some of the common myths within the community as well as outside is that, well, it can't be abused because it's the same sex, or especially sort of women on women. There's instances where it might be that there's two feminine women, it might be that one's more masculine than the other, so they assume the masculine one's the abuser when actually it might not be. So it's kind of they're playing into the heterosexism, as it's known, sort of those ideas of how the relationship works, and it's not always the case.
One of the issues that I see a lot through the LGBT community is this lack of awareness of it being a problem. There's almost some kind of feeling, understanding that this is something that happens. So particularly when we're looking at, within the LGBT community, there's the sex on the premises venues that a lot of the LGBT community frequent, and that somebody being touched or somebody being groped within that is just something that happens. There's this idea that, well, if you're going into a sauna or a bathhouse, then, and you're kind of walking around naked, then people have the right to touch you. And there's this idea that that's an okay thing, and it's not. That somebody's assaulting you. If you haven't consented to them touching you, it's an assault. And trying to get that message across to people to say, this isn't okay. People have the right to say no. Doesn't matter what their sexual preferences, it doesn't matter what their sexual behaviour is, everybody has the right to say no. And I think that's one message that really needs to be kind of told repeatedly, to let people know that it's not just something that happens, it's not okay, it's not acceptable. And I think that's a fight at the moment. That's something that people haven't heard and need to hear and need to be made aware of.
There are different kind of terms and languages that people use around the LGBT community, and I think for organisations and professionals, treat the person who's in front of you and see how they identify or how they would like to be perceived. There's a lot of misconception or lack of understanding around some of the issues, even sort of using the right pronouns for how they address people. Don't be afraid to ask sometimes, because I think sometimes people are so afraid that they get things wrong, and actually if you just ask the question, you know then.
One area that particularly is that there's a real lack of understanding around is around the trans community. And it can be an area that people are really unsure about, or really unaware of, that they have a real lack of information on. And I think that any organisations that might be working with people from the trans community, if nothing else, one of the really important things to do is to find how to communicate with somebody effectively, in the sense of using correct pronouns. It's really simple. If somebody is coming and telling you that they're female, then you use female pronouns. That's a really simple thing. It doesn't matter what you're thinking or what you see in front of you. If they're saying they're female, and you use a female pronoun, it's she, it's her, and vice versa. If somebody comes and tells you that they don't have an identified gender, if they don't see themselves as male or female, that's not for your judgment. That's just to accept them and say, that's fine, I can use they, that's not a problem, I can find other ways around it. There doesn't need to be the difficulty there. If you can just give somebody that, it might be a tiny step, but that could just make a real difference to somebody in getting that right, in just using those kind of the right wording, the right terminology.